Hi, welcome to my next day of my total hip replacement recovery, and I will quickly record the exercises that I do. I will do usually I would recommend it is 10 to 15. I do about 20, 30, depends. I will tell while I'm doing exercise how many times I usually. So flexing the foot up and relax. This I do. Let's do about 30 times. This can be done all the time. Actually, basically, when we're resting, it could be done many times a day. Next is raising the knee. This way, I'm using some muscles on my hip. Yeah, this can cause sometimes some discomfort or pain around the places around the muscles of the hip. In my case, thigh muscles, upper thigh muscles, right below the hip. We should repeat this also. Oh, this is, yeah, there is some level of pain. We should do this for, I think, about 20 times. Next one is pressing the knee down. So as you see today, the muscles of the thigh are working better. So basically I'm using power to press the knee down. This I do especially before I go to sleep a lot of times, because then I have a lot of time to rest the whole night, right? But this is actually kind of stretching. All the feeling of the thigh and the hip is like stretching. And the next exercise actually I developed today, because I discovered my range of motion. I can pull the leg from this position outside to inside, which yesterday was actually kind of impossible. 2 days ago was completely impossible to move like that. And now I can move from side to side, especially inside. I can pull the leg without much discomfort, and there is still not complete feeling in the muscles. However, well, some muscles are working since I can do that. This I also do, I mean, maybe 20 times, 30 times. Then I developed the exercise. Actually, I can do some sit-ups today, very shallow ones, but before it was impossible. So I'm doing that kind of sit-ups for the hip. This hip is working fine. However, my right hip operated. The muscles were incapable of doing this kind of exercise. It was basically either dead or painful. So this I would recommend maybe 15 to 20.
Okay.
And this is the new exercise that I developed. Since my leg, ouch, my leg still cannot go up at all. So I actually lift it and I pull and I basically do the front kick, like stretching the muscles of the thigh. So what I do, I grab my leg, lift it up a little bit, and make sure that my knee goes straight, completely straight. This way is training for the thigh muscles. It's about 20 to, well, 15 to 20 times is fine. Can be more. Right under knee, I grab. Right under the knee. Today I can keep my balance quite well, and I do the lift up on my toes, grabbing something in case I lose balance, to be ready. But basically I'm trying to do this on my own. This can be also done about 20-30 times, depends on the person. And then I side lift legs, both very carefully, especially carefully on the operated hip, because there is not yet full power there, full control. So I make sure that when I land on this leg, I'm really holding my balance. Maybe we can do like 1, 2, and then 1 here, and then I repeat this up to 50 times. For me it's easy, depends on the person, how many times person can repeat that. And the next exercise is for the hip front muscles, to move them and stretch them, and today I can make a much further movement forward, but still too little. However, if I want to lift my knee, it's still basically the same as yesterday. So these two exercises I combine. Lifting up the leg, which I'm actually using the help of the other hip, another leg, and then lifting up the knee forward, which that causes pain and tension right inside to the from the front, right inside down to the inside of the muscles of the thigh, down to the knee. Okay. My walking today is I'm using much less power of the reliance on my crutches, and I move the other side. And basically I'm trying to do also very small steps with one crutch or so. Okay, to lift something I rely on completely on one leg, not to mess up anything with the hip, and then I'm trying to walk with just one crutch or even without it, but I have to do very careful steps. Okay, and then I do squats as Dr. Young recommended. Not too many, I would say 20 to 30, it's enough. Make sure that the knees, when they are bent, not pointing further than my toes. So basically I'm not putting the knee too much forward. The knee and the toe or instep should be aligned. And I'm exercising the inside and as well as front end of my hip, as well as some buttock muscles. So this is kind of helpful exercise. But Dr. Young recommended not to do this too many times in the first 2 weeks. So maybe 20, I think, to 30 times it's enough. Okay, tell me when.
Mm-hmm.
So basically that's how I'm squatting. Make sure that the squat is not just from the knees, but this is from the hip, like we would sit down, like position just before sitting on the chair. Okay, and that's it for my next day of my total hip replacement recovery. Feel much stronger than yesterday. Of course, I'm impatient, so I desire a much faster result. However, this is kind of better than previous days. And today I will also remove my wound dressing since it's kind of hot now in Taiwan. It is sweaty, so I rather try to keep it dry. That's it. Thank you very much, and then see you next day tomorrow. Bye bye.